This case was sent for consultation in hematopathology. Is a 47-year-old female with a mediastinal mass and also a bronchial lesion. As you can see here, this lesion is about 2 millimeters in the widest diameter, almost round, and is clearly endobronchial. There are scattered cells with a classical typical morphology of Hodgkin Reed-Sternberg cells, binucleated and mononucleated, with a prominent amphiphilic nuclear line that express CD30 in a Golgi pattern. CD68 highlights the prominent presence of the macro environment of histiocytes, which are not neoplastic. Cytokeratin is negative, part of the screening. CD20 shows several B cells that are also part of the microenvironment. CD3, as you can see here, is prominent, but is not expressed in the neoplastic cells or cells of interest. CD1A is negative. S100 is negative with a little bit of background, but negative. CD15 is also positive in the neoplastic cells, as you can see here. OCT, that is one of the particularly important transcription factors of the B program. Those are essential for the Ig gene expression or transcription. In this case is mildly positive, which is rare because you expect them to be negative, but we can say that this is a downregulation because it's usually frankly positive when you're dealing with B cells that have the complete B cell program. BOB1, in this case, that is very useful. There's also a transcription factor is negative, but in this setting, this is MOM1, typical of the activation of the B cells. I will show you the BOB1 a little bit. ALK is negative. CD23 is also negative. And I think we have here the BOB1. Yes, this is the BOB1. Is negative or downregulated. Finally, we will check again the typical features of the Hodgkin lymphoma. In this case, endobronchial, which is rare but is described in several articles in the literature. Main problem with this case is that may cause obstruction, airway obstruction, and that is considered a relative urgency or oncological urgency. This case is highly probable that the mediastinal mass is the bulk of the disease. Let's close the case. It's signed it out as an endobronchial presentation of a classic Hodgkin lymphoma.